It's day 6 of ICD iCAMP at the World Health Organization in Geneva, Switzerland, and our participants are continuing on. They are preparing to take on the enormous task of creating the ICD-11. The primary focus of the work today was to create the appropriate documentation necessary to support the iCAT platform. A large part of this process is encompassed in the concept of RTFM, also known as Read the Fabulous Manual. Our managing editors and classification experts are already well versed in the general workflows of the review process and the iCAT platform. Not only must they be able to use the system, however, they must be able to teach others to use it as well. Future users of iCAT include tag members, workgroup members, and later on in the beta drafting process, any individual contributor.
Body systems or physiology.
Our participants split into several small groups to review and refine the 2 manuals that will serve as supportive references. The first manual, known as the Style Guide, is for the ICD content model. It provides clarification on how to create an ICD category and defines the parameter of the model itself. The second manual, a guide for reviewers, will outline the criteria and procedures to be used in the selection of the content proposal peer reviewers and to guide the review process itself. Part of this process will involve a more in-depth review of the iCAT platform from a technical perspective.
iCAT is a platform that allows the joint authoring of the ICD content by medical experts all over the world. It is an open, web-based platform that can be accessed from any web browser over the internet. People all over the world can access it, watch the progress of the ICD development, give us feedback on it, make proposals for changes. iCAT is using open source software, Web 2.0 and semantic web technologies, such as the BioPortal, which is an open repository of over 150 biomedical ontologies. We are very fortunate to be together with our users at this meeting to get the requirements directly from them. We hope that the users will build a tool together with us so that they can better fulfill their tasks.
This process is very important, as the sheer volume of work required to create the ICD-11 would not be possible without the valuable contributions of many qualified individuals and expert groups.
The Revision Steering Committee is an organization that allows the coordination of many of the components or contributors to the ICD-11 with the opportunity that the technology platform that Tanya described available to us, the opportunity to leverage vast communities of people with domain knowledge, people with classification knowledge, people with knowledge of consistent methodology, and people with understandings of new developments in health, biology, and medicine. The membership of the Revision Steering Group includes, of course, the chairs of the various topic advisory groups. The topic advisory groups are more or less the domain segments, for example, internal medicine, maternal and child health, pediatrics, and related specialties that have knowledge about their area. The Revision Steering Group is where they all come together and where we have the opportunity to understand, well, what are the implications of an internal medicine disease on pediatrics and vice versa? Are there controversies about where a concept should be categorized? At the end of the day, to maintain a statistical classification that is mutually exclusive and exhaustive, we have to make choices.
We have 3 days left of ICD iCAMP and a lot more work still to do. Stay with us as we prepare to launch the next stage of the ICD-11 project.